when will this end? Because this is like 4 months in, and there are days like I can't get out of bed.
For some long haulers, the lasting effects of the COVID-19 virus has been more than physical. Many are experiencing depression, anxiety, brain fog, and sleep disorders.
Because there are some days that you'll be like, I can climb up a mountain, you feel good, and the next day you are like useless.
Laura Ijiwere contracted COVID-19 in November and was told she was COVID-free at the end of 2020. But she is still suffering from chest pains, loss of smell and taste, and as well from another symptom she can't quite describe, but says is often the most painful.
A lot of people don't really understand, because sometimes you're like, I don't feel good today. And aren't you supposed to be getting better? Or is that, it's like, normally when you're ill, you go from, because they see you the day before and you're fine. And the next day you're just down, and it's like it's all in your head.
But in our clinic, we're seeing a lot of people who are coming in and they've experienced COVID and they've kind of recovered. And what we're seeing now are long-term effects and impact on their mental health and wellness. We're seeing clients coming in with diagnosis of depression, with diagnosis of anxiety, post-traumatic stress disorder, with a clientele that has never had a diagnosis of any kind of mental health issue before in the past.
Last November, Quebec announced it would invest $100 million in mental health care in hopes of helping bring down the number of people waiting for services from 19,000 to 16,000 by 2022.
I think that right now we're in a healthcare crisis. Clinics are overloaded. We're a private clinic and we are overloaded. So you're absolutely right. And then when they go into the emergency room, from what I'm understanding from clients who come to see us, is that the emergency room is really looking at the physical impact, but dismissing possibly the mental health impact just because they're not equipped at that moment to deal with it.
Laura Ijiwere, who currently doesn't have a family doctor and was unable to get a referral for a mental health specialist, says she had to go find her support on social media.
And I'm like, no, this can't be just, there have to be other people going through this as well. And then I found the Long Haulers group, basically, and I felt some relief, and they have been very helpful, because sometimes when I'm really, really down, I just go there and type, and, everybody's like, because there is nobody judging you, we're all going through the same thing.
Ijiwere says finding the Facebook group and being able to share what she's experiencing with other long haulers has helped her bring some normalcy back to her life.
And although they're wonderful and it's such an amazing space to kind of connect with other people who understand and who are feeling what you're feeling, so I think it's wonderful. We just have to be careful because some of those groups are not monitored by professionals or psychotherapists or counselors who truly understand the emotional impact.
In Montreal, Sacha Obas, City News.